Hafide, and welcome to My Story. My name is Michelle Sasamoto, and I am your host. Today we have Dr. Joel Rubio, who will be talking about thyroid cancer. Dr. Rubio is an internal medicine specialist and an endocrinologist. Thank you for joining us. Please stay tuned. We'll be right back. Thank you for joining us. Today we have special guest, Dr. Joel Rubio, internal medicine specialist and endocrinologist. Thank you for joining us today, Dr. Rubio.
Thanks for having me.
Could you please tell us a little bit about yourself and what inspired you to practice what you're currently practicing?
Well, I'm proud to say that I am raised in Guam for a part of my life. I did the last part of elementary school here and middle school. Before going off island to go to undergrad and then med school in the Philippines at University of the Philippines and University of the East, respectively. And then I went off to New York City and trained in a Cornell program for internal medicine, and then did a fellowship in endocrinology at the State University of New York at Stony Brook.
Wow, that's wonderful, and thank you for coming back and providing services to the island.
Happy to be home.
We're going to be talking about thyroid cancer today, and so with the internal medicine specialist, endocrinologist, of course, there's a connection. Could you tell us a little bit about why the thyroid gland is important and what is the bodily function of it?
Okay, very nice question. The thyroid gland, and I can use the model for you. No?
Sure.
It's a butterfly-shaped gland here in the neck. It's just beneath the voice box or larynx. In men, the Adam's apple. Okay. It sits right on top of the trachea or the air pipe. And its number one function in the body is as a factory of thyroid hormone. Now, thyroid hormone itself is very important to the rate at which our body burns energy, or our metabolism.
Metabolism, yes. Wonderful. So I know with the thyroid gland, like from my experience, I know it's like right there, like you explained to us. And also here in Guam and the neighboring islands, there's a high incidence rate of thyroid cancer compared to the United States. Dr. Rubio, can you tell us, in your professional opinion, maybe what are some contributing factors to that?
Yes. Okay, well, when you look at the cancers, you look at the demographics of your population, right? The incidence of thyroid cancer specifically is increased in Caucasians and Asians, especially in the US studies. Here, we have a large proportion of Filipino population, especially on Guam. We have a 26% declared Filipino population. And let's say half of that is female, 13%. Well, let me tell you, thyroid disease is 6 to 8% more common in women. And it is also very common in Filipinas.
I see.
So, population-wise, yes, we are one of the risk. We are one of the populations at risk.
And that's just by ethnicity.
By ethnicity. Yes. By exposure, there's actually been an epidemiologic study in the early 2000s, a local study with our local public health service with Dr. Haddock as the territorial epidemiologist, and Renata Bordallo in the study that looked at radon gas exposure and the incidence of thyroid cancer. And they found that, especially up north in our northern villages, there is an increased radon exposure risk and an increased risk in thyroid cancer. So that's another possible explanation. No? A third explanation is that people are more attuned. Physicians and other primary care providers. They're more attuned to thyroid disease and thyroid cancer, and they've done more examinations of the neck, and that's actually how you pick up thyroid cancer commonly. You feel a lump in the neck, or you've done, say, an ultrasound or a CT scan or a chest x-ray, and you actually see the lump incidentally on those testing studies.
Okay, so screening also kind of
Screening
increases the chances of catching thyroid conditions or thyroid cancer.
Yes.
For people to get some help with that, right?
Yes.
To my understanding, I know that there are different types of thyroid cancer. Could you please tell us a little bit about that?
All right. So if you read the textbook, there will be 4 types. No? The most common would be papillary, what's called papillary thyroid cancer. The next common would be follicular thyroid cancer. These two are what you call the differentiated cancers, meaning if you look at their cells, they don't look very different from normal thyroid cells.
Okay.
And that actually makes them the easiest to treat. And these are the curable thyroid cancers. Medullary thyroid cancer is rare, and anaplastic cancer, which is the worst type, is very rare. Most thyroid cancer occurs between 40 to 60 years of age.
40 to 60. And you're seeing that same trend on the island with
Yes.
females
Yes.
being at a higher prevalence rate.
And I have to mention the 5th type of thyroid cancer, which is cancer that's spread there from somewhere else.
I see.
There is one particular lady that sticks to my mind. I was consulted for this lady who was an ICU patient, and the poor lady was in pain, a lot of pain, and they noticed her neck was large, so they called me in, and indeed, she had a large thyroid tumor.
Right.
It's just that she was in pain everywhere, including her chest. And one large tumor in her breast stood out markedly. So what I did was I biopsied her thyroid tumor, and it turns out that it was a spread from her breast.
Wow. So 5 different types of cancers. And I know like also that there are different types of thyroid conditions, right? And I mean,
Yes.
the most common ones that I've heard are hypo and hyper. And mainly from what I know about it is it's usually connected with weight loss or weight gain. Could you tell us a little bit about that?
Well, we said the thyroid hormone controls our metabolism, right? So if we lack thyroid hormone, we have a condition called hypothyroidism, where metabolism slows down.
Okay.
And this is where the weight gain comes from, the sluggishness, the low energy. No? Internally, people are not able to break down cholesterol, and so their cholesterol levels go up, and so they'd be more prone to blockages in the heart and in the brain, leading to heart attacks and strokes.
Right.
The opposite would be too much thyroid hormone, which is hyperthyroidism, and things speed up. So in general, people would lose weight even if they ate a lot. Some people like this.
Yeah. Some people do. but not for the most part,
it's
right?
not a good way to lose weight,
Right.
because it'll make you sick.
Absolutely.
The common organs systems that would be affected would be the heart, because it doesn't like to be sped up that much, and also the bones lose a lot of calcium, osteoporosis with hyperthyroidism. But it's what's called a systemic disease, so eventually the entire body is affected
Okay.
with both conditions.
So, you know, and just kind of like relating that and looking at the symptoms, and some people lose weight, some people may gain weight. What are some other symptoms, Doc, that people that may have thyroid conditions just look out for?
Well, if you lack thyroid hormone or hypothyroidism, no, low energy, tendency to feel cold, constipation because the gut doesn't run normally, dry skin because your skin cells don't turn over normally,
I see.
and again the elevated cholesterol.
Elevated cholesterol.
The opposite with hyperthyroidism would be a speeded up heart rate, speeded up thinking, irritability, nervousness, heat intolerance, maybe an increased tendency to go to the bathroom for number 2,
Right.
because the gut definitely goes. For women, menstrual periods may be affected and can actually get shorter or less menstrual flow. Some people actually stop menstruating if they're floridly hyperthyroid.
So at any point when someone is experiencing any of, what you had just mentioned, it's always best to seek medical advice and
Yes.
to see a doctor at the earliest. Absolutely. And so with all of that, you talked about the cancer and also the survival rate of thyroid cancer. Could you tell us, Doc, what is that survival rate?
I'm happy to say that of the types that we talked about, and these make up 90% of thyroid cancer, so it's papillary and follicular, there is greater than a 98% survival rate if picked up early and treated.
Welcome back to My Story. Joining us today is Dr. Joel Rubio, and we're talking about thyroid cancer. Thank you, Dr. Rubio, for coming back to the show. Earlier, I was very interested. You were talking a little bit about this diagram and visual. I'm a very visual person.
Yes.
And we talked about, hypothyroidism and hyperthyroidism. So I'm learning how to say these words a little better. Could you share with us a little bit more, like what are the significance? There's 3 different thyroid glands that I see.
Yes.
And what should we be looking out for with these models when a patient comes in and, you're talking to them about it?
Yeah. So we talked earlier about the function and the dysfunction
Right.
of the thyroid gland. So let's talk a little bit about the anatomy. It's very close to the surface of the skin and the front of the neck. So if it enlarges, let's say that's a normal size thyroid gland, and this is, okay, let's do that again. So let's say this is a normal sized thyroid gland, and this is an enlarged one.
Right.
No? So that's what you call a goiter. Goiter, plain and simple, is an enlarged thyroid gland. And the goiter can be enlarged diffusely or evenly. And it can be enlarged because there is a lump in it. Or there is a lump in it. Or it can be enlarged because there are several lumps in it. No? So that's the anatomy of thyroid disease.
Okay.
It could be a smooth enlargement, or it could be what you call a nodular enlargement or a lumpy enlargement.
And they could both be detected when you're doing the screening and checking around the area of
yes.
the thyroid.
Well, experienced clinical examiners can feel thyroid nodules. In fact, they say the detection level of our fingertips is about 1 centimeter. But I was lucky enough in fellowship to detect maybe a 0.5 centimeter
Wow.
in palpation. No?
And that's why it's, again, very important to seek treatment if anything, any symptoms are coming out, like what you mentioned.
And examine those necks.
Absolutely.
Right.
And so, we're talking again about an individual who has thyroid cancer already. What are some of the treatment? What's like that treatment process like for an individual?
What I like to do is make sure of the diagnosis. So initially, they would come and consult with me. Their doctor found a lump, or they found a lump on ultrasound of something else in the neck, like maybe the carotid arteries, or maybe a CT scan of the neck, and chest. And so we go on and, if appropriate, sample the nodule. There is a simple office-based procedure, usually guided by the ultrasound, which I have in my office. And it's simple, and it's under local anesthesia, the same anesthesia that the dentist uses. And we numb up the skin, and with skinny needles, we take some cells away from the lump and smear it on a slide, send it to the pathologist. And after about a week, you have a diagnosis already. So it's the quickest way of making a diagnosis of whether a lump is cancerous or not. If worst case scenario, the lump turns out to be cancer, we spoke about this, 90% of the time it's going to be the differentiated type of thyroid cancer, which is amenable to early surgical intervention. So the next step would be removal of either half of the gland or the entire gland, if there are several nodules or lumps interspersed in the gland.
Right. And again, it's always, treatment is very important, but we also know, being in the region, the limited treatment that is available, is that offered here in Guam? Like, if a person that had to go through those procedures, would they be able to get that
Yes.
treatment services on the island?
Absolutely, yes. We have a dedicated head and neck surgeon, a dedicated head and neck surgeon in our community.
Okay.
Dr. Jerry Castro. We're very happy he's here. A lot of the general surgeons are also confident in being able to do thyroid surgery.
Wonderful. So accessibility is definitely a plus on the island
Yes.
for this particular
Definitely, we
cancer.
can do this treatment on island.
Wonderful.
Adjunct therapy, if necessary, is radiation in the form of radioactive iodine, and that is also available on
On
island.
island. Okay, it's promising. Again, so, just for anyone like myself that has minimal information on thyroid conditions or thyroid cancer, what would you say, Doc, and how could one further or be able to prevent this incidence from occurring to them?
Okay, dietary wise, no? An adequate iodine intake in the diet is necessary. Usually not a problem for us, because we're an island. Most of us eat seafood, and so iodine comes from there. Certain vegetables are rich in iodine. Peanuts, cabbage, green leafy vegetables. Most meats will have iodine. And our salt, usually Morton salt, is iodized.
So just a balance, again, diet with some of those things that would help to prevent
Yes.
would be good for daily intake, right?
Yes.
Are there any
Another-
types of foods that maybe people shouldn't eat that could cause or could bring you to a condition of hyper or hypothyroid?
There are certain populations, not usually islanders, more inlanders, where goitrous enlargement of the thyroid gland is more prevalent, because of the factor that we were talking about.
Yes.
They are iodine deficient.
Right.
They don't get to eat a lot of seafood.
Yeah.
I've seen this in the mountain provinces in the Philippines.
Mm-hmm.
Yeah. They're far removed from the coastal areas,
I
and
see.
they have what's called an endemic goiter.
Very interesting to see, like, even regionally, how it could be a contributing factor to different, occurrences. Doc, I can't imagine being
But-
in your position.
Let me add a little bit. Avoiding radiation exposure is another way of preventing thyroid cancer and thyroid lumps in general. No, we already talked about early screening. No, and what people can do at home would be self neck exam.
Exactly.
So feel around your neck, look in the mirror in good lighting, and if you notice a lump, go and see your doctor.
Right.
No?
Don't wait again. Just take action where
Yep.
it's needed.
Yep.
Um,
With your friends, do a mutual neck examination, right?
also, you
Go-
could do that. Like,
Yeah, it's
you
just
examine
look-
each other's necks.
Look at each other's necks, yeah.
Yeah.
If you find a lump, go get checked.
And it's reassuring when there's somebody else there, because sometimes it's scary when you experience or when you find, lumps anywhere. Automatically, I'm certain our viewers are probably thinking that, they have some of the symptoms that you talked about, because they're very general symptoms. In saying that, Doc, now that, you have to also deliver the diagnosis to patients, right? And I can't imagine how difficult that is. How does that impact you on a personal level?
It's never easy to deliver bad news, particularly cancer news, no? But if on biopsy, the cancer type is of the more common variety, then I deliver the news, but I'm hopeful, and I share the hope with my patient, because I say, okay, I think we detected this early, and we can remove it, and it may be a total cure. So I'm happy to be able to deal with a cancer where we can do this most of the time,
Yeah.
90% of the time. No? I have, saying that, I have dealt with the horrible anaplastic type, and this has a bad prognosis, and so you have to involve the patient and their family, because there needs to be relief from the choking that this particular cancer does. No? So sometimes there needs to be creation of an artificial hole in their air pipe or trachea, so that they can breathe.
Yeah.
Because this cancer is so horrible, it squeezes or suffocates
Right.
the patient.
And the silver lining that I'm just taking away here today, Doc, is again, if it's detected and if it's treated, there's a possibility of the survival rate. And having the treatment on island, it's an amazing thing because of the familial support, right, that could be around them for the healing and recovery. Dr. Joel Rubio, thank you so much for being a guest in our show today. We are going to come back again with another episode. We'd just like to thank Dr. Joel Rubio for being here. Join us in the next episode of My Story. Thank you very much.
Thank you.